Hi everyone, myself Hannah Elsa Abraham, an audiologist and a speech language pathologist, and I welcome you all back to my channel, The Happy SLP. Today is March 3rd. Do you all know what's the importance of today? Let me explain. World Hearing Day is held on 3rd March every year to raise awareness on how to prevent hearing loss and also to promote ear and hearing care across the world. It is World Health Organization or WHO which decides the theme for every year. And the theme for this year is Hearing Care for All. For those of you who don't know much about hearing loss and its rehabilitative measures, continue listening to this video and I hope this would help. First of all, let us see what is hearing loss. Hearing loss is loss of hearing in one or both the ears and the severity can range from mild to profound. Now let us look on to the statistics. And we can see that in worldwide after depression, hearing loss is the second leading cause for years lived with disability. Around 450 million people in the world is suffering from hearing loss. Nearly 1 out of every 3 people over 65 years have hearing loss. According to WHO 2018 data, around 63 million Indian people are suffering from significant hearing loss. Now, let us look on to the causes. Hearing loss can be caused by chronic ear infections, frequent exposure to loud noise, occupational noise, family history of genetic disorders with hearing loss, ototoxic medications, trauma or injury to the head, illness such as Meniere's disease, otosclerosis, and also age-related hearing loss can occur for people over 60 years. You might be thinking, how will I know if I have hearing loss? Let me tell you the major symptoms. You might have difficulty understanding everyday conversations. You might have to turn up the volume of TV, radio, or other devices. You might ask others to repeat often. You might avoid social situations. There might be excessive earwax or frequent discharge from your ears. Balance issues, as you know, ear and balance are very much related. You might have tinnitus or ringing sound in the ears. You might have increased difficulty in understanding in noisy situations like in restaurants or on road and all. So moving on to the types. Our ear is made up of 3 parts, the outer ear, the middle ear and the inner ear. The first type of loss, the conductive hearing loss, occurs when sounds cannot get through outer and middle ear. For people with conductive hearing loss, soft sounds would be difficult to hear. Usually, medicines or surgeries can often fix this type of hearing loss. The second type, sensory neural hearing loss, happens after inner ear damage. Problems with the nerve pathways from our inner ear to brain can also contribute to this type of loss. Unlike conductive, sensory cannot be fixed with medicines or surgeries. Hearing aids might help you to hear better. The last type, mixed hearing loss, is a combination of the first 2 types. There might be a damage in the outer or middle or inner ear or in the nerve pathway to brain. Another major point to be discussed is children with hearing loss. In the case of babies, you must suspect hearing loss if the baby doesn't respond to sounds, especially the mother's voice, or is not startled by the loud sounds, or cannot understand what you say, or if the child has an improper speech language development, or has any discharges, or suffers from repeat episodes of pain or blockage of the ear. Always remember that the earlier the better. This means that a child must get rehabilitative measures as early as possible. More than 40 million children live with disabling hearing loss. When we see the major causes in children, we can see that they are mainly caused by infections like meningitis, measles, ear infections, or even birth-related causes like low birth weight, prematurity, and few with intake of ototoxic medicines also. So consequences of hearing loss in kids, if not addressed, can lead to delayed language development, academic underachievement, high risk of injuries and social isolation. Now let's move on to tests for hearing loss. First we'll see what are the tests for babies. All babies should be screened for hearing loss not later than 1 month of age. It is best if they are screened before leaving the hospital after birth. If a baby does not pass a hearing screening, it is very important to get a full hearing test as soon as possible, but no later than 3 months of age. Now let us look on to all the children. Children who are at risk for acquired, progressive, or delayed onset hearing loss should have at least one hearing test done by 2 to 2.5 years of age. Hearing loss that gets worse over time is known as acquired or progressive hearing loss. Hearing loss that develops after the baby is born is called delayed onset hearing loss. Find out if your child may be at risk for hearing loss. If a child does not pass a hearing screening, it's very important to get a full hearing test as soon as possible. So, how does a hearing test work? Adults and children who fail in the hearing screening test should undergo an audiology evaluation. An audiologist is an expert trained to test hearing, will do the full hearing test. During an audiometry evaluation, a variety of tests may be performed to find out if a person has a hearing loss and how much of a hearing loss there is and what type it is. The hearing tests are easy and not painful. In addition, the audiologist will also check questions about birth history, ear infection, and also the hearing loss in the family. So, if you're thinking, where can I find an audiologist? I'm coming to that point. Almost all of the hospitals have an ENT department where the ENT doctors would refer you to the audiologist present there. Or you can also directly approach a hearing clinic nearby and consult the audiologist there. Let us look on to the major treatment measures. Treatment is available for people with all types of hearing loss. It depends on the cause and severity of the loss. First, let's see hearing aids. These are wearable devices that help in hearing. They don't cure hearing loss but rather amplify the sounds that enters the ear so that the listener can hear more clearly. Next, let's see cochlear implants. If the eardrum and middle ear are functioning properly, then those people may benefit from a cochlear implant. It's majorly used in patients whose hearing loss is caused by the cell damage in the cochlea. Sign language and lip reading. Sign language and lip reading can replace or complement oral communication. Now let us see how can we prevent hearing loss. Do not insert any object into the ear. WHO recommends listening at not more than 60% of mobile device volume and also not more than 60 minutes at a time. Use earplugs and earmuffs in noisy places. Move away from sources of sound such as loudspeakers. In case of any ear issues, consult an ENT immediately. Check if medicines you take can affect your hearing. Have your hearing tested regularly. If advised to do, use a hearing device as indicated. I believe I was able to give you some information about hearing loss. So before I end, let me share an important message. Don't let hearing loss limit you or your kids. There are no barriers which we can't break through. So be kind to people who can't hear and repeat if they haven't heard you properly without much judgments. This alone can bring a huge difference in someone's life. So before I close, let me remind you once again, please do subscribe to my channel and also share this video among your friends whom you think this would help. You can always contact me, the Happy SLP, either via comments or through my social media accounts, Facebook or Instagram, regarding your concerns and queries regarding speech, language, hearing and swallowing issues. I'll be providing the links in the description and I would try my best to help you. So until we meet again in another video, stay happy and much love. Hannah, the Happy SLP.